Thank you so much, Mr. Partha, for sharing your incredible journey. Good afternoon. I'm extremely honored and privileged to stand in front of you and talk about few very basic things as we, the healthcare professionals, fail to educate the educated or the uneducated people about their health-related conditions. Most of us sitting here are already healthcare professionals, and so my focus is not towards the people who are already healthcare professionals. It is towards the people who don't understand the complicated terms used by us, the doctors, while they are understanding about their bodies. So when we talk about anemia, what exactly is anemia? We say that it is khoon ki kami. But what exactly is khoon ki kami? We tell the patient that it is a condition where we lack enough red blood cells to supply adequate amount of oxygen to the tissues. And having anemia is also known as a low hemoglobin. But then the patient comes and asks us, what exactly is hemoglobin and what are RBCs? So for that, I'll use a simple visual where you can imagine that the blood is like a river. And in that river, there are plenty of things floating around in it. But the river also has a boat. In that boat, we have cargoes. The boat represents the RBCs, and the cargo is the hemoglobin in which the oxygen is sitting on top of it, which needs to be delivered to the vital organs and our tissues. So when we have lower number of boats, then we have lower supply of the cargo. So that signifies that if we have lower RBCs, we have lower hemoglobin and lower oxygen that is being supplied to the vital organs. The most common causes leading to anemia that we tell our patients are usually nutritional deficiencies, the hemoglobinopathies, the infectious diseases, and the parasitic infections. But then we fail to tell them that these are all the technical terms that we are using, but where the person who is coming from a low socioeconomic background will never understand them. And then we have to tell them and make them aware of the social issues like poor healthcare seeking behavior, like women who are eating low iron rich diet in a household in which everyone else is having a proper nutrition, but she is not having that. And pregnant women don't get the proper diet, the proper nutrition that she needs. With that, she develops iron deficiency, and she gives birth to a newborn who also has iron deficiency. There are even some environmental factors like climate change, which result in the impairment of the crop and agricultural yields, leading to food shortages and insecurities, which trigger a higher prevalence in our society, and especially in their area. We also notice that these conditions and these risk factors that I have just stated are all very easily preventable risk factors, and with just proper prior knowledge about them, we can prevent the anemia from happening in the first place itself. According to the latest survey, approximately 67% of children in the age group of 6 to 60 month old have anemia in 2022. And it has drastically increased since 2016 when the previous survey was conducted, where it was 58.6% only. And not only, it is very disheartening that the percent has increased so much. And in adults, we have 57% of women who are suffering from anemia, and 25% of men in the age group of 15 to 49 who are suffering from anemia. In India, anemia in pregnancy is a very big public health problem. And with that, we have 45.7% of women in the rural and the urban area who are suffering from anemia with a hemoglobin of less than 11, we would say. Then globally, 1 out of every 4 individuals usually suffer from anemia, which has higher prevalence in the low and middle income countries. Iron is a key component of hemoglobin, and iron deficiency is estimated to be responsible for more than half of the anemia cases globally. With these figures, it is a very, not a soft blow, but a very hard blow to the Anemia Mukt Bharat strategy that had a target for the reduction of anemia with the prevalence of 3% per year. But from where we are standing right now, it is less than 1% that is being reduced per year. Most commonly, our patients present us with fatigue, weakness, pale skin, shortness of breath, etc. But do you know about the impact it has on children? As the years between childhood and adulthood represents a sensitive phase for development of psychological and behavioral changes, anemia in these formative phases of life can reduce the work capacity of the child. It can also impair the neurocognitive function and delay the pubertal development of the child. This also causes an increased prevalence of getting infections in a very early age. Therefore, regarding them, it is not just a public health issue. It is also a social impact and a social problem for them when they go into the adulthood. We previously used to have methods to investigate hemoglobin via manual lab-based tests. Then we had automated hematology analyzers, hemoglobinometers, hemoglobin color scale, etc. But the first and most prominent drawback that you would notice in these methods is that you have to collect blood from it. And while you are collecting the blood, the most common problem that is being faced is milking of the finger, which causes dilution of the hemoglobin concentration and that results in a wrong hemoglobin count later on. And they also require perfect labs and trained lab technicians. They are expensive, and their results are sometimes, like for the color scale, the results are based on the pure subjective and clinical judgment of the person who is sitting there and making the test done. So this is where our device, EasyCheck, comes and shines the brightest. It is a non-invasive portable device which can detect hemoglobin without using a single drop of blood from the human body. Apart from this, it is affordable, it is IoT enabled, and it means that we can upload our report and use it for online consultations as well. Then no healthcare professional is required for this, and a semi-skilled person, a layman, a commoner, so we should say, can use the device easily and get his or her report in just few seconds. This quick method of getting the hemoglobin done is, I think, incredible and amazing, and I don't think that you can say that it's not good. And with this information, we can clearly see how EasyCheck can be helpful in our healthcare system, especially in the remote and rural areas where we have a scarcity of the facilities that are being provided and are available to our population. The social impact. Our healthcare system is already in a constant turmoil, and due to the inaccessibility of the medical services and financial constraints, there is a delay in the diagnosis, and the health problems lead to 1 million deaths per year. With EasyCheck, we are making the screenings easily accessible, and the facilities of diagnosis and preventable health condition is more easily accessible. Our ancestral methods were wise and apt for their era, but accepting the upcoming changes and adapting them are the basic law of nature. So we say the next generation AI is the future of our healthcare. So with this, I'll give the stage to Mr. Sudeep, who is the CSO and co-founder of EasyRx, who will take the presentation further.
Thank you.